Take care of your heart, yes, but take care of your kidneys is not something you usually hear your doctor say. But the truth is that our kidneys play a very integral role in our overall health. They filter out waste and toxins from our blood, regulate blood pressure, produce hormones, and even help with bone health. But despite all that they do for us, we rarely pay attention to our kidneys' well-being. In fact, some of our daily habits can actually damage our kidneys and lead to serious health problems down the road, like chronic kidney disease or even kidney failure. While many of us may be aware of the common culprits like smoking and excessive alcohol consumption, there are some lesser-known habits that can also take a toll on our kidney health. In this video, I'll share with you the top 5 bad habits that can destroy your kidney health and what you can do to avoid them. From your diet to lifestyle choices, I'll cover everything you need to know about protecting your kidneys. So, without turning a blind eye to your kidney health, let's get started and make some healthy changes for the sake of our kidneys. Overusing painkillers. We all experience aches and pains from time to time, whether it's a headache, muscle pain, or joint stiffness. And when these discomforts get out of hand, we often turn to over-the-counter painkillers for quick relief. But what many people don't realize is that excessive and prolonged use of painkillers can harm our kidneys and other organs in the long run. Non-steroidal anti-inflammatory drugs, NSAIDs, and analgesics are 2 of the most commonly used painkillers. While they can provide temporary relief from pain, inflammation, and fever, they also come with potential side effects. One of these side effects is kidney damage. According to a study published in the Archives of Internal Medicine, long-term use of painkillers can increase the risk of developing kidney cancer by 50%. This is because NSAIDs and analgesics can interfere with the normal functioning of the kidneys and lead to inflammation, reduced blood flow, and even permanent damage. This risk is even higher for people who already have kidney disease. Overusing painkillers can also cause other kidney-related issues, such as acute kidney injury and interstitial nephritis. If you don't want to put your kidneys at risk, it's important to only take painkillers as directed and not exceed the recommended dosage. Instead of relying on painkillers, try alternative methods to manage pain, such as physical therapy, acupuncture, or natural remedies. Not drinking enough water. One of the most common bad habits that many of us have is not drinking enough water that our body needs. We often forget to drink water throughout the day or choose sugary drinks instead, thinking they will keep us hydrated. But the truth is that nothing can replace the benefits of drinking plain old water. And when it comes to our kidney health, staying properly hydrated is crucial. Our kidneys rely on a steady flow of blood to function properly and filter out waste products from our body. When we don't drink enough water, our kidneys have to work harder to filter out these toxins, which is not only taxing on the organs but can also lead to kidney damage in the long run. Dehydration can also cause a buildup of minerals and salts in the kidneys, leading to kidney stones. These painful stones can block the urinary tract and cause further complications if left untreated. It can also lead to urinary tract infections, which can be quite uncomfortable and may even require medical treatment. Also, if you don't empty your bladder early enough when nature calls, it can put unnecessary pressure on your kidneys and lead to problems like incontinence or even renal failure. If you're a woman, then you should aim to drink at least 8 200 milliliters glasses of fluid a day, while men should aim for 10. So, make sure to avoid dark cola and sugary drinks and instead sip on some plain old H2O throughout the day to keep your kidneys functioning at their best. Consuming too much sodium. The third bad habit that can really make your kidneys suffer is consuming too much sodium. While salt is an essential mineral for our body because it helps maintain a proper balance of fluids and electrolytes, too much sodium can be harmful, especially for our kidneys. As we consume more sodium than our body needs, our kidneys have to work harder to filter out the excess and maintain a balance. This can put unnecessary strain on the kidneys, and if it becomes a long-term habit, it can lead to kidney damage. High sodium intake has also been linked to an increased risk of developing high blood pressure, which is one of the leading causes of kidney disease. Also, processed foods like chips, crackers, canned soups, and frozen meals are significant sources of sodium. These foods are often high in salt because it helps preserve them and enhance their flavor. However, regular consumption of these processed foods can lead to excessive sodium intake and put our kidneys at risk. If you want to reduce your sodium intake, try to adopt a healthier diet like the DASH diet. This diet focuses on whole foods like fruits, vegetables, lean proteins, and low-fat dairy products while limiting processed foods that are high in salt. Also, you should try to limit your daily sodium intake to no more than 5.8 grams per day. By cutting back on salt and choosing healthier food options, you can protect your kidneys from potential harm. So, next time you reach for the salt shaker or processed foods, think about the impact it could have on your kidney health. Not sleeping enough. The fourth, and I would say the most surprising bad habit that can harm our kidneys is not getting enough sleep. As they say, sleep is the best medicine, and it turns out it's true for our kidneys as well. Our kidneys function on a sleep-wake cycle, just like our bodies do, and getting enough restful sleep is crucial for their proper functioning. When we don't get enough sleep, our body produces more of the stress hormone cortisol, which can increase blood pressure and potentially damage your kidneys over time. Also, a lack of sleep can interfere with the body's natural healing processes and hinder the renewal of kidney tissue, which can lead to long-term damage. A study by Boston's Brigham and Women's Hospital found that too little sleep was linked to a more rapid decline in kidney function in women. There are also many other ways that a lack of sleep can harm our overall health, including obesity, heart disease, and decreased immune function. So, if you want to protect not just your kidneys but your overall health, make sure to sleep for at least 7 to 8 hours every night. If you struggle with getting enough sleep, try to establish a regular bedtime routine, avoid caffeine and screens before bed, and create a comfortable sleeping environment, as these can all help promote better sleep. Eating too much protein and sugar. Now, the fifth bad habit that I'd like to talk about is more common than you might think, and that is eating too much protein and consuming too many sugary foods. While protein is essential for our body as it helps with the growth, maintenance, and repair of body tissues, consuming too much protein can put a strain on our kidneys. As our bodies digest protein, they produce ammonia, which is a toxin that the kidneys need to neutralize. If we consume too much meat, our kidneys have to work harder to filter out the excess ammonia, which can lead to decreased kidney function over time. It includes not just meat but also dairy products like milk and cheese, which are also high in protein. On the other hand, consuming excess sugar can also be detrimental to our kidneys. As we consume more and more sugar, our body produces more insulin to keep up with the increased blood sugar levels. Over time, this can cause the kidneys' filters to thicken and become damaged, leading to decreased kidney function. High sugar intake has also been linked to a higher risk of developing type 2 diabetes and obesity, both of which can contribute to kidney disease. So, instead of drinking soda, eating sugary snacks, and consuming a lot of protein-rich foods, try to incorporate more balanced meals that include whole grains, fruits, vegetables, and lean proteins like fish or chicken. By reducing your sugar and protein intake, you can help protect your kidneys from harm. While the top 5 bad habits that we have discussed in this video are quite detrimental to our kidney health, there are many other habits that can also harm our kidneys. Some other common bad habits include sitting still, lack of exercise, not treating common infections quickly and properly, smoking, and not getting a checkup annually. Therefore, it is essential to be aware of our daily habits and make changes where necessary to protect our kidney health. By adopting a healthy lifestyle and making conscious choices about our diet and habits, we can keep our kidneys functioning at their best and prevent kidney disease. Also, one thing that I would like to point out is that the information that I have provided in this video is gathered from various reliable sources, which include kidney.org, healthshots.com, and bluenethospitals.com. So if you want to learn more about how to maintain good kidney health, I highly encourage you to go and check out these sources for more in-depth information. I hope this video has given you valuable insights into how bad habits can harm our kidneys and the steps we can take to protect them. If you love what you learned today, make sure to hit the like button and subscribe to our channel for more such informative videos. Until next time, try to kick those bad habits and take care of your kidneys.